Life at Helen Hayes was beautiful. From my bedroom window, from my hospital room, I could see a beautiful view of the river, the Hudson River, right outside the window. I did lots of therapies there, as you can imagine. I believe it was speech, occupational, and physical therapy. I particularly loved physical therapy. My therapist was Tammy Goodnow, and Tammy was and is a rock star angel in my life. She was the woman that taught me to walk again. The most special memory I have is it was upstairs, sort of looking in Helen Hayes over the main atrium, and I took my first steps into my daddy's arms. Tammy would not let me leave Helen Hayes until I was able to walk. I left with a walker, but it was because of Tammy's dedication and commitment to therapy that I was able to walk out of Helen Hayes.
Hello, I'm Tammy. I'm a physical therapist at Helen Hayes Hospital. I worked with Angela when she was first admitted. The thing that stands out most about Angela was how fearless she was. She had very aggressive goals to be very independent, high-level goals that were very long-reaching, but she would try anything to get there. She had absolute faith in the therapists. In the beginning, when she was taking her first steps and she really couldn't stand without falling down, she had people around helping to catch her, and she would try anything and just rely the utmost on the therapists and the staff around that we were not going to let her fall or let anything bad happen to her. She had, for the bulk of her stay, she had a big halo on with the screws going into her head, which created an additional balance problem when you're trying to walk, when you're trying to stand and do anything. But she didn't let that stop her. She would just say, "What am I doing today?" And you could give her the most advanced skill, the most difficult skill, and she would try her hardest. It wasn't always pretty, but she always put 100% effort into it and relied completely faithfully on us to make sure that she was safe through everything, which is one of the reasons why she made such rapid progress despite how severely injured she was.
The other therapist I remember and love is Terra, a speech therapist. Terra was the one that gave me the tough love. She was the one that found me napping in my room after a therapy session, and she said, "Would you nap on your job?" What I loved about Terra was she encouraged and inspired each of her patients to maximize their healing potential. So thank you, Terra.
My name is Tara. I'm a speech and language pathologist here at Helen Hayes Hospital. I knew from the get-go Angela didn't say much, and she didn't say much because of the difficulty communicating that she was having. But I think what was so fantastic about her was that she had something behind her eyes. She really did. I knew from her history and with the type of career that she did that she was a go-getter. She was clearly extremely intelligent, and I knew she was very capable and determined. When Angela came to me, again, she had difficulty communicating, so there were very little words spoken at first. But I did see in her eyes this little sparkle, this little light. It kind of led me to see her soul a little bit. And I think that I knew right away that she had a lot of potential. I think as therapists, we have a responsibility to get to know our patients, but we should all have the desire to really care for them. And, you know, with Angela, not only did I have to get to know her, but I wanted to get to know her. I wanted to help her get back to the life that she had. Not just a life, but the life that she had, and a life that was meaningful for her.
I believe that everyone who leaves any medical institution, hospital, the real work begins with the support of family and loved ones. For a traumatic brain injury, this did not impact just me. It impacted my whole family. And the troops rallied together to help me rebuild my life. Truly, the most remarkable recoveries you see all the time are because of the family members who have come together to help support that patient.